At Lentis Psychiatric Institute, people with a psychotic disorder are offered a yearly routine outcome monitoring, or ROM screening. During a ROM screening, we check how people are doing with regard to their mental health, their physical health, and also their social well-being. This can help us while making treatment plans, because it helps us to know which areas we should be paying attention to in treatment. Treat is a computer application embedded in the electronic patient file. It helps us to interpret the results of a ROM screening and connects them with the current guidelines for psychosis care. 27 mental health care workers from 4 different psychiatric institutes in the Northern Netherlands have participated with 187 patients in a study to evaluate the effectiveness of the Treat application. Patients were very satisfied with the treatment consultations where their ROM results were discussed regardless whether or not Treat was used. Shared decision-making between mental health care workers and patients was very high, both with and without the use of Treat. They did, however, discuss 20% more of the patient's care needs when Treat was used. In particular, care needs in the areas of physical health and social well-being were more discussed with Treat. Mental health problems were always well discussed, with or without Treat. With Treat, patients and mental health care workers also more often made an evidence-based treatment decision after discussing a care need. With evidence-based care, we mean offering treatments for which there is scientific evidence that they are effective. The amount of evidence-based treatment decisions for physical health care needs doubled, while the amount of evidence-based treatment decisions for social well-being problems even tripled with the use of Treat. Treat does not get in the way of the contact between patients and mental health care workers, but it leads to an increased number of care needs being discussed that are otherwise often neglected, such as physical health problems. On top of that, it increases the amount of evidence-based treatment decisions for the patient's care needs. This makes Treat a useful application to improve treatment for people with a psychotic disorder. In other words, treat them with Treat.